Hey guys, it's Michael and Elena today, and today we're going to be giving Elena her MENOPUR shot. So first we're going to go over the things that you need. Number one, we're going to need our syringe, because we're going to be doing subcutaneous. There's two different methods, but this is the one we're going to use today. So make sure you got the proper needles, and make sure you get that from your provider or from the pharmacy, because it does not come in your MENOPUR kit. We figured that out the hard way. We have our sharps container, so you can drop your syringe in there when we're done. Alcohol prep pads for where we'll be doing the injection, and also for our medication tops. A sterile pad for afterwards cleanup. We have these little things called Q caps. They go on top of the medication. That's what we're going to mix it with. We're going to pull our saline out with this, use this to inject it into our medication containers to mix it. MENOPUR. This is the medication box. Our Q-tips, our saline, and the MENOPUR come in this. This little peach colored tab, that's what your MENOPUR is. Your gray tab here is the saline. So for our doctor's prescription, we're going to take half a milliliter of saline, and we're going to inject it into this vial of MENOPUR, which is 75 international units. And then we're going to draw it out and put it in our second one. It's going to give us 150 international units, depending on what your doctor prescribes, whether it's 75 or 150. Before we get started, we're going to wash our hands. No towel. I'll lay a slacking on that. Anyway. So we're going to open our syringe. Comes with the needle already on there. You just twist it off gently. We're going to take all the tops off of our saline and our medication.
And those just pop right off, correct?
Yeah, they just pull off. We're going to open our Q-tip. Our Q-cap. It's kind of wedged in there, so you kind of gotta push it out. It's got a little point on the inside there you don't want to touch. That's what's going to puncture the cap. Alright, we finally managed to get our Q-cap out. This is what it looks like. Just take your syringe, put your Q-cap on the end, slowly twist it on there. Now we're going to come back. We're going to get ready to get our saline out. First thing, you watch these, it instructs you. You just wipe the tops of these just to make sure everything's clean before you go putting your Q-cap over. Then you just take the tip of this and you just kind of roll it. It's going to puncture that rubber seal in there. Now for this one, we're taking out half a milliliter. Go down. Probably gonna have to go a little past the mark because of the air in there. Okay, so we're right there at the half a milliliter. We don't have any air in there. And just pull it off. Set that aside. And we're going to take one of our MENOPURs. If you look closely in there, you can see the little white nugget that's in there. Take our saline, push it on top, and we inject our saline in there. Now it says not to shake this. So I just kind of rotate it around, help it dissolve in there. You can see once it's fully dissolved in there, you shouldn't have anything floating around. It should be just slightly cloudy. So now you're going to take it and gonna turn it upside down again. And you're gonna withdraw all your medication. Once that's done, just take it off. And you do the same thing to the next one if you're doing 150 units.
And you're inserting it into the MENOPUR, right?
So it's the same amount of saline, we get twice the medication. Don't worry if you get a little air in there. We'll get that out and get our needle in there. We'd rather have a little air than to waste some of this. So now, take our Q-cap, twist it off. Come back over. Get our needle out. And we reinsert our needle in there.
And does the needle just screw on there?
Yes, just like it's screwed off, just like the Q-cap screws on. So now we are pretty much ready to go until we have our victim, the patient. Okay, so now we're going to clean the injection site. Instructions are, but it's about an inch and a half from the belly button. And we're going to go in at a 45 to a 90-degree angle. So since this is subcutaneous, she's going to squeeze the area that we're going to inject. You got to turn towards the camera a little bit. And take a needle right here. As you can see, the subcutaneous one is a fairly small needle. You don't have to go in very far. Now we're just going to get the air out of here. Just going to go up until we see a little drop come up. Alright, now we're ready for the injection. So you're going to take the hollow side of the needle. I don't know if you can see it on there, but you're going to have the hollow side facing out. So when you go in, it's going to go right above the skin, or right below the skin, I'm sorry.
I'm pretty sure you're getting a lot of enjoyment out of this.
You might want to spread your fingers a little bit so I hit your finger.
Oh, what?
Just kidding. Alright, let me know when you're ready. Needle in, you can kind of go quick to get through the skin and get it over with, and you just want to inject slowly. Pull out slowly. And we're going to get our sterile pad. And we're just going to put some pressure on there until the bleeding stops. And we just drop our needle in the container. That's all you have to do.
If you guys have any questions, please let us know. Or if we can explain something a little bit better. Thank you guys always for watching. Alright, love you.